Hello, my name is Emma, and this is my oral examination for kinesiology. So today I want to talk about why my conditioning program is the way that it is. I decided to work mainly in upper and lower body exercises because of the deviations that I have, mainly in my shoulders and my scapulae and my hips and knees a little bit. Every day we'll have some sort of cardio, whether it's intense or not, and then it will have lengthening exercises for either upper or lower body, and then the strengthening exercises for the other set. It will also include a fascial release or a meditation. Most days it is a fascial or dome release. However, I do have um, some meditations and mindfulness on slower days. There are 5 exercises that I want to specifically talk about. The first being hamstring curls. This is due to a deviation that you can see from the side. The left side of my hip is anteriorly tipped, so that means that my quadriceps are short, and those are my vastus medialis, lateralis, and intermedius, along with my rectus femoris, and my hamstrings are long, which are my semimembranosus, semitendinosus, and biceps femoris. And the exercise that I would like to do, these are definitely you're able to do these in the gym as well. However, just for you to be able to do it in the comfort of your home, you can't really see, but I have the TheraBand under my standing foot and around my working ankle. And what this will do, it will be an open kinetic chain concentric movement, and it'll also be unilateral because only one side of me is affected. So what you're going to do is you're just going to use concentric movement to bring your heel up to your glute, hold it for a second, and release. The next exercise I want to talk about are lat pull downs. This is due to a deviation you can see from the front. My shoulders are both slightly elevated, which means my levator scapulae are short and my latissimus dorsi are long. So this is why I decided to do lat pull downs. For lat pull downs, of course, again, all of my exercises are able to do with machines in the gym, just because this is the best way that my body reacts. However, I have modified them to all be TheraBand efficient as well. For this one, you're going to put both your hands inside the TheraBand and above your head. If standing, this would be an open kinetic chain, but because we're sitting, it is more of a closed kinetic chain. It will be concentric movements, and it is bilateral movement. You're going to have slight pressure on the outsides. You're going to bring your spine into neutral, your hips and your head into neutral and slightly up. Then, using your latissimus dorsi, you're going to bring it down and behind your head. You're going to squeeze there for just a second and then lift back up. The next one I want to talk about are fire hydrants. With fire hydrants, this is due to a deviation you can see from the back, as my femurs are both medially rotated. Because of this, I have my internal rotators are short and my external rotators are long. The internal rotators that I'm talking about are my tensor fascia latae, my obturator internus, my gluteus minimus and medius, along with my my gemellus superior and inferior. And the things that are long are my external rotators, so my glute max, my quadratus femoris, my adductor longus brevis, and longus brevis and magnus. And these are done on all fours. and it will be an open kinetic chain because our leg will be up, and it's concentric contraction here, and it's unilateral movement. So you're going to bring your leg up to the ceiling and out, or the other way around. So up and then around. You're going to hold it for just a few seconds and bring it back down. The next thing I want to talk about, let's see. The next thing I want to talk about are seated rows. This is because my scapulae from the back view are both anteriorly tipped, which means that my pectoralis major and my upper trapezius are short, and my rhomboids and my lower and middle trapezius and my anterior serratus anterior are all long. So this, I'm not sure if you can see as good right now because just of how to do this, but I'm going to put this around my feet, and I'm going to sit super tall and my chin slightly up. I'm going to have a slight bend in my knee, and I'm going to be holding the TheraBand like this. I'm going to pretend I'm going to squeeze a pencil in between my shoulder blades as I bring this into my chest. This is a concentric movement, and it is bilateral, and also it's a closed kinetic chain. And you will do as many reps as you need. Oh, sorry. Excuse me, I just had something in my throat. Now, the last exercise that I want to talk about is a TheraBand hip abduction. Now, this is because from the front view, I have genu valgum. This means that I have lots and lots of deviations and long and short muscles, so just bear with me as I get through them. The first is the things that are short, and those things are the vastus lateralis, the semimembranosus, the IT band, and the external rotators, which include the piriformis, the obturator internus, the gemellus inferior and superior, and the quadratus femoris, and the glute max. Now, the things that are long are my adductors, so longus, magnus, and brevis, and the semitendinosus, and my biceps femoris as well, and my hip abductors, which include my my gluteus medius and minimus, and my tensor fasciae latae. Now, this last exercise is also going to be used with the TheraBand, and you're going to put it just around your ankles. And you can make it as long or as short as you can. Right now mine is long just to be adjustable with all the other exercises. However, you're just going to keep your weight over your standing foot, and you're going to bring your working leg up, and you'll feel the burn right here. This is an open kinetic chain and a unilateral movement with concentric movements here. You'll do this, you'll hold it, and then you'll slowly bring it down and do as many reps as you require. Thank you.